realized at that moment how incredibly broken the system is and how set up it is to basically dismiss and gaslight patients when something goes wrong. And I felt like I must not be alone. There's no way I'm alone experiencing this. And I found many women online who experienced the same thing, and yet it's still not recognized in the mainstream medicine, and they don't have an answer for you other than taking medications or taking more organs out of your body. Well, welcome everyone, and welcome Margy. This is my conversation with Margy, my friend that I met during my neurodynamic breathwork facilitation program in 2022 during COVID. And we bonded over the fact that we're both nurses, both from California, and we're both always trying to make sense of what's happening in our healthcare system and also in ourselves. Welcome, Margy.
Thank you, Monica. It's great to be here with you today. And I would say, truly, you were one of the gifts that came about through COVID and the breathwork class and meeting you and becoming friends with you, because it helped me not feel so alone as a nurse in the healthcare system. So thank you.
Thank you. I feel the sentiment very much. I also feel like you were one of the best gifts that came out of COVID for me. And it was so wonderful to see another fellow nurse during the neurodynamic breathwork facilitator program. I feel like we nurses have a very special bond.
Yes. And I remember the kind of hesitation on talking to you at first. And then it was like, oh, phew, we resonate.
I know. I felt the same. I was like, I wonder how, Margie's thinking. And then I thought, well, she's here during COVID. Maybe there's a chance she feels the same way I do. Yeah. Well, speaking of all that and nursing and how we got into it, let's talk about that. Let's talk about what pulled you into nursing in the first place.
Well, so I became a nurse late in life. I graduated nursing school in 2015, but it was back in 1998 when I was in massage therapy school, and I was a single parent, and I also was just always scrambling trying to get by in life. I eventually ended up at FedEx, but when I was in the massage, I was like, I want to be in healthcare. And at that time I was thinking more like as a naturopathic doctor. And, I needed to wait until my kids were a little older because I didn't want them slipping through the cracks while I was too busy, because I get little OCD and I like A's, and you can't get sick. I can't miss school, So I decided to wait. And what happened was, then as they got older, my mom got older too. She was diagnosed with Alzheimer's. So I took on her care. And it was through that process of going to all of the doctor's visits with her that I realized that nursing is where I want to suits who I am, because I really like the relationship aspect. So so that's how I got here.
Very good. That's a great story. And yeah, I bet that a lot of times when we are either a patient ourselves or when we're advocating for someone, or like with your mom, you were with her at the doctor's visits, it could wake up something within us, right? The resonance with either the relationships or whatever else. For me, it was actually somewhat similar, because I was also a patient when it came to me that I want to be a nurse. I was in a postpartum room. I just had my second baby, my daughter, and I was in postpartum, and I was thinking what a wonderful job it is to be a labor and delivery nurse and be there present at birth, the most important time of many people's lives, and witness that basically and help them through that experience. And so as I was in the postpartum room, I thought I really want to be a labor and delivery nurse. I don't know what it takes, but I will try to do it. I think my daughter was only 9 months old when I started prerequisites. I did night school for a couple of years, and then I finally graduated in 2006. And lo and behold, I ended up applying at the same hospital that I had my children at. I applied to be a nurse, a labor and delivery nurse, and I was accepted, which I was ecstatic. It was like a dream come true for me. I loved every minute of it, and I thought, okay, I'll stay here forever. But as we get into talking a little bit more, I guess the universe had other plans for me. So yeah, that was kind of my journey to nursing.
Yeah, it's amazing, because My journey too, the universe showed me that it had different things in store for me than I had originally planned. But it's also I got into the mainstream medical system because of experiences like yours, and then because I had had a lot of experiences myself. So, and it's just amazing to me how like beautiful and resilient we all are. The body wants to heal and stay in alignment. We just
Yes,
have to get the correct ingredients.
that's
That's and that's the challenge right there, right?
That is the challenge right there. And as we both now know, within the mainstream medical system, once you get in it and start seeing different things there, maybe you might get even a little bit disillusioned with it. And the dream that you came into the nursing profession, the caring profession, the most trusted profession, when you get into it and you start seeing the darker side and maybe kind of the dark corners of the system, your belief system changes and kind of evolves over time. And I know I definitely had some of those moments. And do you remember, or can you recall a moment when you were in the nursing world working, that when kind of the veil lifted, when you saw something that made you question everything or question how the system is working?
Absolutely. So I was a public health nurse during COVID, and the veil, what I saw going on during that time, the veil just disintegrated. I ended up in kind of a state of shock. I couldn't understand how all these people, my coworkers, because they're good, caring people, how they could, just go along with what was happening. It was definitely a shock to me.
Yeah, I definitely agree. And when you think about what people work in the system, I would say for the most part, it's very good. Very good people work in the system. Most people have good intentions, right? But it's kind of what at least my experience was that there are a lot of people who are just kind of compliant, who comply with whatever they're told and they don't question it. Whereas then come people like us, where we do kind of take a step back and start questioning and start thinking, okay, this doesn't seem right. This doesn't feel right. What is this really about?
Yeah, and at the same time, I feel I was very lucky and grateful because I was working on the front line with the vulnerable populations, and so I could literally see how many people were not getting sick and were not dying. And some of the things that they were implementing that were going against their own information and teaching and standards of care. So for that part of it, I felt grateful that, I was there and able to experience that and see it firsthand. The other thing, is, fear is very powerful. And with everything that was going on in the news, because I was very, I was really scared at first. I'm watching the death counts, tickers,
Wow.
and I'm like, yep, nope, I'm not going into anybody's home and gonna kill them. That's not my calling. But yeah, so that fear, and it's like the whole world was under this fear of things that weren't necessarily true, but it's very powerful, and that's what I saw. The people that I worked with that were very caring, good nurses and good doctors. I think it was the fear that just disconnected them from, what they were like, their intention of how they, got into the field was for.
Yep. I completely hear you. I think a lot of people before COVID didn't think about these things at all because they just, were going to work and following orders and everything seemed to kind of more or less work just fine. And then COVID put yeah, I think a lot of people woke up during COVID, and that it ties a little bit into my story where my veil lifted. And again, it was during when I was a patient, but I think kind of lucky, I guess I can say for me, it was way before COVID in 2012. So years before that. And so once COVID hit, I already felt like I know what I'm looking for, like the signs and what to question. Because if I didn't have this experience, which I'll talk about in a second, is if I didn't have this experience, who knows what I would feel and what decisions I would make. And maybe I would also be caught up in the fear of it. Whereas having gone through this experience that I'll describe in a second is I felt like I already had the experience of making a decision out of fear and ending up with a consequence that basically cost me my health. And so what happened, my story is that in 2012 I had a tubal ligation and I worked in labor and delivery. I saw tubal ligations done all the time. I didn't think much of it as far as are they safe? Are there side effects? And I also talked to my surgeon, someone I worked with for years. I spoke to friends who had them done and I did my research online. So I thought I was well prepared to go into the surgery. One of the main things I asked the surgeon was, what is the risk to my body? Will my body feel different? Will my hormones be different? What's the big risk? And he said, there is no risk like that. Your body will feel exactly the same. You just won't be able to have kids. And I said, okay, great. But to make the very, very long story short, I ended up with post-tubal ligation syndrome, which is not even recognized in the medical system. They basically don't believe it exists. When I went back to my doctor and told him about all these symptoms, he said, it's not possible. It's not possible. Women who make these symptoms up is just because you're getting older and stuff like that. So I felt very dismissed. But I also felt like, well, if the doctor says that I am wrong and he's right, it must be true because I had the mentality of, listen to the doctor and doctor knows best and the experts know best. So I pushed my intuition down and I quieted it for a few years. But when I saw that the medical student solution was to give me more medications. So they offered me more surgeries, which I didn't want, and I didn't want the medications they were offering me, and then they referred me to psychiatry as if, something's wrong with my head. 2 years or 3 very long years later, I decided it's finally time to take matters in my own hands and find healing on my own because I knew the medical system is not going to help me by taking more organs from me or prescribing me a bunch of medications. So I ended up having a tubal ligation reversal, with which I was told is not possible. But I found a doctor who did reversals, and the surgery really fixed, I would say, 80% of the issue I had. Now, of course, I was left with severe emotional and mental anguish from this entire experience. I would even call it medical trauma on top of experiencing medical harm. And that's really how I got into where I'm at now, which we'll talk about later. But I realized at that moment how incredibly broken the system is and how set up it is to basically dismiss and gaslight patients when something goes wrong. And I felt like I must not be alone. There's no way I'm alone experiencing this. And I found many, many women online who experienced the same thing, and yet it's still not recognized in the mainstream medicine, and they don't have an answer for you other than taking medications or taking more organs out of your body. So that was definitely an experience that completely flipped my belief system upside down, my thinking about the medical system, and even questioning, like, how do I now feel about being a nurse? But I was able to find healing. And also, I just wanted to say, for people who are interested to hear more about this story, more details, I do have a video on my post-tubal ligation story. But my point basically here is that I did find healing, but I found it outside the medical system, not within it at all. All of the healing was done outside, and was about basically reconnecting to my intuition, listening to it this time, not quieting it down, and following my intuition to healing, because we all have a inner healer within us that when we connect to it, we can heal from anything.
Yeah, I totally agree that the inner healer is within us. And that's where, like, in part of this process is us learning how to, tune in, listen, and then respond.
Yeah.
Yeah, because I've heard, but sometimes I override it and go to the doctor knows best. And so, really, a part of my journey at this point is learning to trust and to follow that inner guidance within me. You know, I am like you have had, well, not that, but multiple experiences, and that's what even led me to ever wanting to be a naturopathic doctor, was because of the mainstream medicine interactions. They took, I was on lots of antibiotics as a teenager. They took out my tonsils. And then at 26, my gallbladder was removed. And as we're waiting there for the surgeon, my husband's in my purse reading the insert. And on the insert, it says gallstones. I mean, I was 26 and I wasn't overweight or anything like that. So my guess would be that it was, a result of the birth control pill I was on. Um, but one of the things that really led me was my son. Between like 2 and 7, he started getting lots of respiratory infections and ear infections. And when I asked his doctor, how do we prevent these? He said, oh, there's no way to prevent it. You know, he'll just end up with tubes eventually. And so I started reading about garlic, and I'm shoving garlic capsules in his baby bottle. And boy, did he smell. But I was like, we're not getting tubes. And then, the other thing is, so then they started looking at my thyroid and wanting to take my thyroid. And at that same time, a lot of my friends were getting hysterectomies. And I was just like, no, 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 this does not make sense. I was given these organs for a reason,
That's
you
right.
know?
Yeah.
And I'm not giving up anymore. Especially, I mean, it just amazed me the way they would take a woman's uterus and say, oh, here, just take these pills, you'll be fine. None of my friends that were doing that were fine. I mean, they adjusted, but it wasn't like prior to before they had their, everything fallopian tubes and the uterus removed. So that was like really what spurred me into doing a lot more studying and research and, finding doctors. And most of the doctors I saw were doctors, they were MDs that had stepped out
Hmm.
because they realized they weren't getting people well, you know? And that's where I found out I had food allergies was underlying, condition or I think underlying, yeah, condition that was causing all the infections was from the food allergies for me and my son. My son, once we changed his diet, he was fine, but I would still have these periodic like flare ups of illness and stuff. And, and I was on so many antibiotics. I was doing the Candida diet and all of that. And then about 2003, I ended up in bed and I was just like done. I was not able to push through like I had. It just kind of, pull myself up before. And so I was in a position I didn't know if I should plan for living or for death. And I went to my primary care doctor and I told him I'm having extreme bone pain and fatigue. And he's like, oh, well, you're depressed. I'm like, I'm not depressed. I love my life. I am tired. I hurt. And so he then told me I was an uncooperative because I wouldn't take the antidepressants, and so I finally gave in and did. And boy, did I regret that, because then all of a sudden I felt like I popped out of my body and I was out here on the right. And I was like, I can't drive, I can't do anything when I'm not in my body. So I looked up online and I was trying to stay in my health care, my health insurance plan. So, I didn't have to pay out of pocket. And so I found this internal medicine. I'm like, oh, okay, he should be good. I sent him 3 pages worth of symptoms I had been experiencing because I would get all these weird things. Like I lost my sense of smell and taste for a whole year, and then it would come back, and then something else would show up, and the pain and the fatigue were consistent. Everything else just kind of kept rotating around. So that doctor, he did the thing. He looked me up and down and said, "Well, you look fine to me." He said, but I'll order some lab work. And I just about lost it when he did that. And so I took the lab work and I left crying. And one of the nurses came and apologized and said, sorry, he has no bedside manner. But, I was just, I mean, I was sick. I needed help. And so I didn't plan on going back to him.
Yeah.
and and that's when it's like, to just be to listen to that inner guidance. And so I was led to this osteopathic physician. He was one that was, mainstream, stepped out, and cash pay only. But I was like, I have to be worth it.
Hmm.
And this guy saved my life. He listened to me. He was respectful. He, when I argued with him, because he kept telling me I have Lyme disease, I'm like, oh no, oh no, 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 I can't have that because the the treatment is antibiotics, and I won't take any more antibiotics. And so he was patient with me, and he supported me even though I researched and came up with alternative therapies. It took years, but because of his kindness and just honoring, doing, what a doctor's supposed to do, eventually I got well. And then, that's when 2012 I was able to enter into nursing school.
That's quite a story. That's quite a story, and I am sure that many people resonate with that. I bet you your experience is not unique, right? I've gone through something similar, and I know people who've gone through something similar, and I kind of came up with this. I feel like the conventional medicine playbook is is basically dismiss, gaslight, and abandon, right? Or deny, gaslight, and abandon, where they dismiss your symptoms. They're like, oh, you look fine to me, nothing's on your labs. Or they don't even do proper labs to keep searching. And then they gaslight you, right? Tell you it's all in your head, take some antidepressants, and then abandon you because there's nothing else they can do for you. And that's my experience too. And like you said, there's a lot of times when you step out of the system, you run into physicians who were MDs but saw what we see in the medical system and started working outside the system to help people like you and I and many other people. But of course, they're cash pay. I had to cover my surgery. You had to cover your treatment with the osteopath. And that's incredible to me when I think about that every time. I don't know if you feel the same way, but basically the insurance covers either something that can make you ill, but not when you want to get better, or if you have something like you had, right? Kind of not something that's very easily diagnosable, and you have to go outside the system. You are seeing an actual doctor. You are seeing a DO. One of the doctors I was seeing was also an MD that was outside the system, but yet they don't take insurance. And that just seems mind boggling that the system is set up this way.
Well, and as I've learned, it's because, the insurance dictates so much of what the doctor can do and not do, right? And then this is one of the things working as a public health nurse, because, my favorite part is helping advocate. So I get to go into the visits with the clients, and the how they were like trying to dismiss them, you
Hmm.
know and it's like, one client I had was having a follow-up for a heart attack. He had been in the hospital, released, was having the follow-up, and I'm like, trying to tell the aide, okay, so he's having some, left arm pain and stuff. She's like, oh, no, 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 we can't, he can't put that on the chart. He can only be seen for one thing.
That's
And
so.
I'm just, and that's because the insurance companies are dictating the doctor has 10 minutes, right?
Hmm.
And
So
so, no, we can't put two things down on the chart. He can only be here for follow up. So, and I know, right? Doctor comes in and say, yeah, he's having left arm pain. That guy jumped up, grabs his stethoscope. I mean, he just released for a heart attack, right? you know but that's the craziness of it. Yeah, that doctor woke up all of a sudden.
so true. And so crazy. And like you say, they dictate, right? They give them this 5 minutes, 7 minutes for a visit, which is about enough time to hear a few sentences from the patient, write you the prescription or the referral, and write the note and get you out of the office. And you feel like, okay, not, I don't even know what happened because and then this prescription, I am quite confident that the patient doesn't get the true informed consent about taking this medication. There's no time to discuss side effects and the risk factors and the true risk and benefit of these medications, or the patient probably doesn't even have time to ask, okay, what are the side effects? And if they happen to me, what's the fix? Are they permanent? Will they go away if I stop the medication? And all those things. Yeah, it's truly become quite a different system than when we got into it with our big dream of being, in the caring profession.
Yeah. It was really neat when I was caring for my mom, and she had the Alzheimer's, and so we took her into the doctor, and her blood pressure was kind of high, and so the doctor's like, "Well, we have options. We can do nothing, or there's this medication, we can give you." And she pulls out the insert, and she says, so it will lower your blood pressure, and it may cause like heart attack, or it may cause constipation. And she's reading off all this, and my mother, and her innocence from the Alzheimer's, is like, oh no, I don't want any of that.
Yeah.
And to me, it was just, it's like, of course, nobody wants any of that. That's why the doctors don't do that,
Yeah.
because they won't, no, nobody wants that, you know. But that was, yeah, that was one of those moments of, I'll never forget. Oh no, I don't want any of that.
Right. Sometimes not taking the medication is a bigger benefit than taking it with putting yourself through all these risks. But yeah, a lot of doctors will not mention it. It's a similar reason probably why they never would mention issues after tubal ligation, because what if women stopped getting tubal ligations? That would be a huge hit on the big medical system, right? Because I think when I was doing my video, it said that 700,000 tubal ligations or self-injectomies are done a year, and then 500,000 hysterectomies. That's a lot of money turning around in the system. So if doctors were warning people, it might make people change their mind and not do these procedures or not take these medications. So they probably give it to you, wait until something happens, and then have the conversation. But that is not true informed consent. Yeah.
Yeah, well, and it's sad that it so much, has come about to the money and what they get paid for, prescribing the pills, or for the procedure,
Hmm.
getting bonuses and stuff.
Yeah.
It's not a very good business model for health.
No. It's a good business model for making us sicker and then try to write a prescription for every symptom.
Well, yeah, it's a good business model for them making money. The
Yes.
pharmaceutical companies, that's who gets all the funding at the end.
Yeah. And also, I don't know if you've noticed, but I noticed in my area where I work at when I started working there, which is almost 20 years ago, we were just a small community hospital. And now it's like this big health system. And almost on every block in town, you see a new clinic or a new hospital or a yeah, it's like exploded. Like there's this need suddenly for new clinics and bunch of doctors. You can't, even if you try to make an appointment for let's say a GYN appointment, just a screening, you can't even get in because there's just so much so many people are sick with so many things, and
Yeah.
it's just exploded over the last 10 years or so. It makes you wonder.
Well, yeah, and I don't think it's just like one reason.
No. Correct.
That's where I educate myself, because as I'm
Yes.
going forward, I truly believe that it's our mindset.
Mm-hmm.
what we believe, and that which we put into our bodies. So that which we put into our bodies is our thoughts, our beliefs, the food, the water, the relationships. I mean, we're all here, and that's the um, importance in, if we want to, be healthy and thrive, is to start paying attention. I mean, so much of that stuff, I don't even like to call it food. It's crap.
Mm-hmm.
If it comes with a label and you have to read all the ingredients,
Yeah.
you got problems right there.
Yeah. If the ingredients list is more than one or two lines, it's not food. Yeah.
Right. So but yeah, it's amazing, like, because the age I am, I've kind of watched it evolve, a lot of it. I mean, my mom, grew up on a farm and growing stuff. And then, now everybody's getting packages, right?
Yeah.
Go to the drive-through, and they subsidize all that crap so you can get 5 burgers for $1. And
Yeah.
when you're poor, sometimes that's all you can do to feed your family. But in the long run, the health consequences of it are
And much
not
more
worth
expensive.
it.
Yeah. Yeah. So true. Well, that brings me to my next question to you. What's calling you these days? What are you up to in your health journey, and what are you working on?
Yeah, well, so what COVID taught me, because I was in a very lockdown county, and as I said, I was a public health nurse, so I was, I hate to use the word front line, because that, in my mind, I'm out there, no, I was stuck at home on a computer, helping manage outbreaks and all of that. But what that taught me is life is too short to be miserable. I
Mm-hmm.
was miserable, okay? So what I've been doing is, it's taken me a while to just grieve and get through the anger and kind of refine myself. And like you were talking about your expectation, I became a nurse at 50 with the
Mm-hmm.
expectation that I would never retire, because I like helping people. But with nursing, there's plenty of opportunities to work, like a weekend here and a weekend there. But after COVID, I realized I cannot work in that system. So, and I feel like this is just another step on guiding me to really live authentically and
Mm-hmm.
in integrity with my higher self. So, my goal is to set up an online platform teaching people how to live in optimal health and how to advocate within the healthcare system, and to travel, because we live in this amazing, abundant world. And I mean, I love meeting people. That's one of the good things with COVID, is I've met people all over and become friends, not only in the United States, but other parts of the world too. Um, so, and just to enjoy it and be of service to how I feel I'm called. I've never liked seeing people being taken advantage of or manipulated.
Mm-hmm.
So that's my goal there.
I love that. I love that. And I think there is a huge need for the services that you're offering and will be offering. And I think that that need will only grow, where people will really seek out somebody's help, somebody like you's help, to guide them through how to get the proper health and advocate for themselves. And that's kind of my goal too with my medical harm prevention and recovery coaching, is because of my experience with my post-traumatic ligation syndrome and then a family member's experience with a vaccine injury, I always, for many years now, I knew that I really want to help people prevent these problems so they don't get into the same place that I got into. And if they do, to help them through it. So that's why I do medical harm recovery, but also prevention, help them, like you said, advocate for themselves, find that self empowerment enough and feel in control of their health because they're the ones who will live with any consequence. And a lot of times, as we both know, just being a good patient, listening to the doctors and following doctors' orders doesn't mean leading us to health. Many times it leads us on a path of actually worse health. And then we get stuck and don't know what to do. So that's kind of what I'm hoping to do. And then, of course, we're both certified in neurodynamic breathwork facilitation, which helps with the emotional, mental, and spiritual healing. So yeah, I'm very excited for both of our journeys and what will unfold. And I also hope that we'll get to do this conversation again, maybe in a few months, and see where we're at and bring a little bit more information to everybody.
Yes, I think it's it's an exciting time, and because the healthcare or I should say the disease care
Yeah.
paradigm is shifting.
Hmm. I feel it.
People are, realizing they're not getting well, and they're paying a lot of money to not get well.
Yeah.
So I think the timing is perfect for both of us. And
Yeah. I
like I said,
agree.
it's just amazing. I'm very grateful to have met you through the breath work, and um, it's a real gift to be able to travel, this road with you.
I feel the same way. And actually, before we part ways, I know that there are probably a lot of nurses who feel similarly that we do and are just getting into the profession or have been in the profession. What would you say that if you could give advice to your younger self or when you were getting into the nursing profession, what advice would you give yourself?
Just to really trust and follow your intuition, that inner guidance, whatever you want to call it, but to trust it and follow it, and not because it's so much of that. Oh, listen to your elders, do what the doctor says, because this is really the time when we get to claim responsibility for ourselves, so.
Yeah, I agree. I agree. Embrace the intuition, listen to it, don't quiet it down, but the other, on the other way, cultivate it every day and follow it because we all have the inner guidance within us and the inner healer that we should listen to. I feel the same way. I feel the same way. So that brings us to the end. I hope that people enjoyed it, and if this conversation brought anyone a little hope or validation, that makes me happy. And I thank you so much again, Margie, for meeting with me. Thanks everybody to listening, and until we talk again next time.
Thank you.